Hi, I'm Zul Surani, and I work for the University of Southern California's Norris Comprehensive Cancer Center in Los Angeles. And USC Norris Comprehensive Cancer Center is a place where scientific discoveries are happening around cancer, new treatments are benefiting people. There's cutting-edge research that could save lives and cure cancer. But one of the things that is really apparent is that communities, Asian and Pacific Islander communities, don't benefit equally from these new cutting-edge treatments that are happening. And that's one of the biggest reasons why I joined the Asian Pacific Islander Cancer Survivors Network. I am South Asian. I've worked with the South Asian communities for over 14 years in cancer prevention and control, and have realized that there's so many disparities that exist. Our communities, for example, people from India, Pakistan, Sri Lanka, Bangladesh, Nepal, Bhutan, and the Maldives don't participate in early cancer screening. Bangladeshi communities only have a 30 to 40% mammography screening rate, for example. And how do we address these disparities, not just at a local level, but at a national level? The Cancer Survivors Network really is positioned to be able to help bring our voices to the forefront at not just a local level but a national level. Through the network, we've been able to create a movement and involve more South Asian survivors that have helped us expand our efforts, take our message to different communities throughout the country. But I also want to, bring up the point that I really didn't know about the cancer experience and how families and patients were affected until it happened in my family. My mother last year was diagnosed with lymphoma and had a losing battle with it, and she passed away just 6 weeks after treatment. And it was, even though our family was extremely informed, we still didn't know much about cancer and cancer treatment. And this question such as, do people benefit, how do you benefit from the new tailored therapies that just target the cancer cells and not the healthy cells and have much better outcomes? And all of these issues we were faced with, and we still felt like we didn't have enough information. And so imagine those who have language barriers, those who come from poor, uninsured communities, who have cultural barriers, probably fare worse. And the API Cancer Survivors Network is really bringing their voices to the forefront in addressing some of these issues.